Gastroenteritis is extremely common in children. Most children will have had an episode of diarrhea and vomiting in the first year of life, and certainly by the time they've gone to school. It's largely caused by viruses, it's very contagious, and it will spread through a family, in a school, in a hospital, as we all know. Occasionally it may be due to a bacteria, as salmonella and some of the other things that cause food poisoning outbreaks, and you get from takeaways and all the rest. It causes a lot of anxiety, but the reality is that most children with gastroenteritis, with diarrhea and vomiting, won't need to be admitted to hospital. What is the most important thing is that they maintain a good intake of fluid. Water, yes, but ideally something with some salt and some sugars, which is to replace those that they lose in the vomit and the diarrhea.
When should I seek medical help for gastroenteritis?
Well, the key thing is that children do not become dehydrated. That can be difficult to assess as a parent, but a simple guideline is that if they haven't passed urine, or they haven't wet their nappy for sort of 6 to 8 hours, particularly if they were drowsy. I mean, if a child with diarrhea and vomiting became drowsy, I'd say go straight away to see your doctor. If their lips start to become dry and the tongue looks dry, then that suggests they're probably becoming dehydrated.
Do I need antibiotics for my child's gastroenteritis?
Antibiotics very often make diarrhea worse because it changes the normal bugs, the good bacteria, the balance that you have in your stomach and your gut. It can change that and actually make diarrhea a lot worse. On the whole, antibiotics are not required as the infections are due to a virus.